Securing to a backboard. For securing a patient to a backboard, use the head restraint system. Slide the backboard pad under the patient. Tear off extra padding and stack as needed for proper occipital support. Then pull the clear film tab to secure. Attach the safety strap to the XCollar anchor point. Then, loop the strap around the backboard as necessary to remove slack before fastening. Repeat on the opposite side. Unlike conventional head immobilizers, the XCollar Head Restraint System secures the splint to the backboard, allowing inline movement of the head with the body. This avoids hyperextension of the patient's cervical spine during transport. New XCollar Head Restraint Yellow Straps. The new XCollar comes with 2 long straps to assist in securing the patient's head to carrying equipment. These straps can be used in combination with our head restraint system padding, including in the new XCollar Plus, or used in other ways to accommodate the patient's head. Slide the yellow securing strap from top to bottom with the loop part of the strap facing up. Engage the Velcro material at the splint's anchor point. Wrap the excess slack around the carrying equipment without putting extra tension on the straps. Repeat steps on the other side. These straps can be loosened or tightened as needed during patient transport.